This is something that's looking increasingly possible as the days go by and as the numbers pile up. Maharashtra continues to remain by far the worst affected state as a result of COVID-19. The state has been recording a spike in cases in the last few days that even tops earlier spikes, triggering fears of a possible re-lockdown in the state. Maharashtra Chief Minister Uddhav Thackeray has warned of a likely Lockdown 2.0 if the spike continues and citizens continue to violate norms as they are doing. However, the Aghadi's ally, the NCP under Sharad Pawar and the opposition BJP are against the possibility of a lockdown. NCP Minister Nawab Malik says that the state cannot afford another lockdown and the Chief Minister has been asked to look at alternative options. BJP State President Chandrakant Patil too has said that a lockdown is unthinkable at this time. On Monday, the state witnessed a dip in cases as it recorded 31,643 cases, taking the total number of active cases in the state to 3.27 lakh and 102 deaths in the last 24 hours. Meanwhile, as the cases surge, Mumbai is facing bed shortages in private hospitals. The BMC has now decided to release all asymptomatic patients.
निश्चित रूपाने लॉकडाऊन हे राज्याला जनतेला कुणाला परवडणारा नाही. आम्ही सर्वांनी मुख्यमंत्री महोदयांना आग्रह धरला की आता लॉकडाऊन हे उपाय होऊ शकत नाही. मुख्यमंत्री प्रशासनाला आदेश देऊन आपली काय तयारी होऊ शकते तसा आदेश मुख्यमंत्री महोदयांनी दिलेला आहे. पण अजून लॉकडाऊन होतीलच असा निर्णय झालेला नाही. अजून वेळ हातातून गेलेली नाही.
लॉकडाउन करो, नो प्रॉब्लम. आप पैकेज दो, चलो 1 महीने के लिए पैकेज दो. सभी ठेले वालों को 5,000 रुपये मिलेंगे, घर में काम करने वाले ताई को 5,000 रुपये मिलेंगे, रिक्शा वालों को 5,000 रुपये मिलेंगे. फिर करो ना, लोग घर में आराम से बैठेंगे. आप कुछ करेंगे नहीं तो 2 समय का खाना क्या खाएंगे? कोरोना से नहीं मरेंगे लोग, भूखमरी से मरेंगे.
And amidst this continuing surge in Mumbai, the Brihan Mumbai Municipal Corporation has issued fresh guidelines for hospitals. Sneha tells you more about that.
And the BMC has issued a set of fresh guidelines as to how the hospitals will be functioning from here on, given the fact that there is shortage reported in some private hospitals. All asymptomatic patients to be discharged immediately. So people without symptoms do not need to be in a hospital. No beds to be allotted for asymptomatics, so even with those with comorbidities. So that's something that the BMC has announced as well. 80% of COVID beds to be allotted in private hospitals and 100% of ICU beds to be allotted in private hospitals as well. All hospitals must be checking their oxygen supply and ventilators is always important to save lives, and all hospitals to maintain an adequate stock of medication, whichever medicines required for symptomatic patients. Well, there is no let-up in increasing number of COVID cases in the country.
India Today's Mustafa Sheikh has been covering this entire new development in Maharashtra, the increased number of cases, as well as the increasing talk of a possible lockdown over the last few weeks. Mustafa, what's it looking like? Fresh guidelines are there. There are disagreements within the government over whether there needs to be a lockdown, but the numbers are very, very compelling. What's it looking like?
Well, it's a catch-22 situation for the Maharashtra government at this point of time, Shiv, because vaccinations are on this point of time, but the numbers of COVID cases are at huge because the surge is as huge. It was not even there in the last year when the COVID pandemic had started. The other point remaining that there is opposition for a full lockdown. In Mumbai, we are getting to see night curfew. Still, the numbers are rising. So what is the solution? The government is trying to figure out some things. They have come out with a policy because there is again a shortage of bed at private hospitals because mostly cases are coming from housing societies and high-rise buildings who are going at private hospitals, and the BMC is now saying that they will be allotting hospital beds and hospitals not be allowed to take any admission directly without consulting the administrative ward of the concerned BMC ward. But these all options are to control the cases. But if the numbers don't come down in 1 or 2 weeks, then the state or the BMC will have to take some strict measures, which the citizens are fearing at this point of time, because economically another lockdown is not viable. Back to you.
Okay, a big lockdown scare is looming over the people of Mumbai especially. But will it actually happen? We'll have to wait and see. The numbers are continuing to rise. Thankfully, in the last 24 hours, there has been a slight dip in the daily cases, but this is still very much a big threat. Whether it is containment zones or a full lockdown, the possibilities have not been ruled out, and that is the most troubling aspect. Mustafa, thank you very much for that. From Mumbai to Delhi, India's capital is the 6th worst affected city as far as COVID is concerned. Over 1,800 new cases have been reported in the national capital in the last 24 hours. India Today's Ashutosh Mishra brings you this ground report from the city.
COVID tally across the country is on surge, including Maharashtra, Kerala, and now the national capital, which is witnessing a 4th wave. The composite number that was provided by the Health Department of the national capital, that says 1,900 cases. So the tally has even crossed 1,900 positive cases in the reported 24 hours time. In fact, there was also 7 deaths reported. However, the government says that since the number of tests extremely higher, that more than 70,000 tests were carried out, which translates around 4.5% of the total positivity case. During the festive season, this surge was anticipated. The government kept telling people, appealing people to follow the COVID safety rules and protocols, not to defy the rules. However, there are some restrictions also being placed by the government, including in the marriage ceremony, where in the open spaces, the number of from unlimited has been curtailed to 200. In a closed pocket, it has been curtailed from 200 to 100. However, the surge is likely to continue amid the festive season, as we have seen from all pockets, crowded places, people defying the COVID safety rules. Is there further going to be any restrictions? Well, that will be announced by the Delhi government. However, the health minister has clearly said there is no possibility of imposing lockdown in the national capital, at least for now. However, if the surge continues, there will be challenges on availability of the beds and hospitals, including both government and private. We'll have to see what government going to take further call on it as far as controlling this pandemic in the national capital is concerned. In Delhi with Sanjay, this is Ashutosh Mishra, reporting for India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.